we do have a community with a lot of different people who also have to take a very good care of their health. More specifically, people who have Medicare or even just want to find out more about their health care options. This is why we have a professional joining us here right on the Splash Live. We have owner of Best Health Options, as well as an independent insurance agent from the state of Michigan, Susan Jackson, joining us here on the Splash. Thank you so much for joining us, Susan.
Hey, thanks for having me. Great to be here.
Absolutely, absolutely. So we want to discuss Medicare benefits and healthcare options because a lot of people don't necessarily get an opportunity to ask questions about it. So let's just first and foremost paint the picture as to why we are even discussing Medicare today, Susan.
Great question. Seniors are really bombarded every year around open enrollment, and that would be starting sometime in September. Healthcare is very important to our seniors, and during that time, they literally are bombarded with phone calls and emails. Stuff coming in the mail, commercials, advising them, to make sure they check their health care and maybe to understand what they currently have. Maybe they're missing out on something. So all that
Right.
information that comes at them at once every year is, raise the anxiety level. And they're wondering, hey, am I in the best healthcare plan, or are there other options for me? So there's people like me that are independent, that are appointed with all the major carriers in the area, and that includes, Blue Cross, Blue Shield, Humana, Aetna, Priority Health. They can sit down with the senior one-on-one to review what they currently have and to see if they are in the best plan. Sometimes they are, sometimes they're not, but there's just so many different choices and so much information coming at them that they just become overwhelmed and the anxiety level goes up. So people like me help them out and, kind of untangle the confusion, and by giving information, it helps them to make good decisions.
No, you hit the nail on the head. Let me tell you, first and foremost, yes, there's a lot of different messages and distractions when it comes to different things. So I understand there's a lot of noise with that. Then when you get into just actually trying to understand one healthcare plan, it's so complex, so many different terms, jargon, premiums, and different so I understand reaching out to a professional like yourself to take the time to break this down means a lot, because some people just go with the first suggestion. But I want to kind of rewind a little bit, if you don't mind, just to clarify things. What is Medicare exactly?
Medicare is a federal health insurance program for seniors that are 65 and older, and for some people that are younger that have disabilities.
Okay. So this isn't like a general health care option for anybody. This is specifically made for our seniors.
Exactly. Yes. And for
Okay.
some people that are under 65 with disabilities, correct.
Got you. Now I know, with that being said, I would assume that Medicare has evolved over the years or generations or whatever the case
Oh,
may be.
yes.
Have there been any recent changes within Medicare that we should be aware of?
Kevin, that's a really good question. I'm not going to unpack all the changes,
Okay.
but for 2025, the prescription drug deductible will be going down to $2,000. And that's very different from previous years. And that's a good thing for prescribers, because we're used to paying anywhere up to $13,000 out of pocket for prescription drugs as a
Sheesh.
deductible. Yeah, you can pay that much. Not everybody does, of course, but for 2025, that's going to $2,000 as part of the Inflation Reduction Act. So that's good news. However, insurance carriers are going to have to pay more than they ever have. Usually their contribution is not as much as it's going to be in 2025. So they're going to be making some changes. Now, nobody knows right now what those changes will be, Kevin,
Right.
but we're anticipating a lot of changes with benefits and with prescription drugs as far as what they will cover. And so we're kind of bracing for a major shopping year this year, when open enrollment starts for Medicare Advantage in October. We're expecting a high shopping year. Recipients do get a notice of change in the mail from their carrier every September.
Okay.
And that's when they can review to see if something has changed, and maybe, whatever they're losing or gaining, um, they have to make that decision and shop at that time. So people like me can, sort it all out and
Yep.
decide, based on their prescription drugs and their doctors and their hospitals of who they want to see. It's very individualized. It's not one size fits all.
Right.
I have couples that maybe the husband has a Blue Cross shield, but the wife has a Humana shield, a Humana program, and that is just based on their particular healthcare situation.
Right. Their particular needs, prescriptions, et cetera, et cetera. I completely understand that. It's not, like you
Doctors,
said, it's not a
correct.
one size fits all, which I'm glad
Right.
we have different options like that. Join us right here on the Splash Live. Owner of Best Health Options and an independent insurance agent for the state of Michigan, Susan Jackson, joining us talking about Medicare and health care options. So since we are facing some changes coming up, and just in general with your profession and your experience, are there any common questions or even misconceptions when it comes to Medicare that you often get asked or inquired from your clients?
Good question. Well, there's a couple, and I'd like just to go over a couple. Some think that Medicare is free. For
Mm,
some people, it is within a certain income bracket, but for most of us, we're paying for Part B, which from 2024 is $174.70 a month. For Part A, there is a deductible. That deductible is excuse me, $1,632 every 60-day benefit period. So
mm,
you're paying that in multiple times every 16 days if you go into the hospital. So Medicare is not free. It also doesn't cover everything. You're going to have a 20% copay. They cover 80% of what's covered in the basic benefit package there. So
got
you
you.
are going to have some copays and some deductibles. And there's also that associated with Part C and Part D, like I said, deductibles and copayments as well.
Okay.
Also, you are not automatically enrolled in Medicare. You have a 7-month enrollment period, initial enrollment period when you turn 65. So you can enroll 3 months before 65, the month of your birthday, and 3 months after. Okay, so
Ah.
you're not automatically enrolled unless you're already receiving Social Security benefits for at least 2 years, and they automatically enroll you.
Interesting. All great. I'm glad you're explaining this because you just explained some things I didn't even know. I thought Medicare was free. I thought it was free for everyone. So thank you for
It is
explaining
a
that
it is
right
a
there.
great it is a great plan, Kevin. It
Hmm.
really is. And when you get to that age, you're going to have some choices,
Okay.
and you'll probably be paying less than you ever have, depending on your health. But I'm looking forward to 65 actually, because you could buy the best health care at that time for
Yeah.
a pretty decent amount of money.
Hey, that's a
So
gift that we're all able to make it to 65
yeah,
for sure, for sure. So I completely
there's a lot of
understand
good
that.
things out there.
Absolutely. So, really, before we go, I just want to ask you, is there anything that the audience, our viewers, should take away from this conversation ultimately before we go that is very important for their health benefits or Medicare?
Yeah, I would just like to say that review your benefits every year, annually sit down right around that time, September, get with an independent agent like myself to go over your options individually with your particular situation and your budget.
Okay.
It's really important. It's not one that you can just, purchase something and let it go. You really do need to review it every year. You may be in a perfect spot and you may need to change,
Yeah.
but that can only be determined if you review it with someone independent that has access to all the plans in the area.
That's a great point too. With that being said, considering the fact that, like we said, everyone is different. Your body, your health probably is going to change over time, and your health plan is going to change, going to make some changes also. So to go back and review that, and if you have questions, then you reach out to professionals like Susan Jackson. Susan, before we let you go, any additional information that we didn't cover that you want to let out, or just any key information for the community that you want to let us know about?
Yeah, I have a couple of different speaking engagements coming up in West Bloomfield. I'd like to share that. I
Yeah.
will be at the Senior Center on Farmington Road having a Medicare 101 seminar, which is free, and that's on June 20th. That's at 10 a.m. And I also have speaking engagements at the West Bloomfield Library,
Mm.
which is a Medicare 101. That is free. There'll be some snacks there too. And that's August 22nd, September 10th, and October 2nd. So that is in the brochure for the West Bloomfield Library, the main branch, and you can check out more information there. You can also go on Medicare.gov and to get all the information about Medicare. Might be slightly overwhelming, but there are resources online that you can get some additional information. But also, I would just, this is what I do for a living. I help seniors one-on-one. My consultations are free. If they want to reach out to me, I have a website. If they want to go to Best Health Options LLC.com, they can find out all the information about me. My contact information is there, and I'd love to meet you and help you with your choices.
Susan, what you do, very appreciated, because trust me, insurance is a very complex machine, and we need people like you to help us, especially me, so I get it. Thank you again, owner for Best Health Options LLC, and an independent insurance agent for the state of Michigan, Susan Jackson. Thank you again for your time. We appreciate it.
Thank you so much for having me. Have a wonderful day.